Let's take a look at what the Prime Minister had to say earlier on today on COVID and the need to keep fighting.
लॉकडाउन भले चला गया हो, वायरस नहीं गया है। बीते 7-8 महीनों में प्रत्येक भारतीय के प्रयास से भारत आज जिस संभली हुई स्थिति में है, हमें उसे बिगड़ने नहीं देना है। ये समय ये मान लेने का नहीं है कि कोरोना चला गया या फिर अब कोरोना से कोई खतरा नहीं है। हाल के दिनों में हम सब ने बहुत सी तस्वीरें, वीडियो देखे हैं जिनमें साफ दिखता है कि कई लोगों ने अब सावधानी बरतना या तो बंद कर दिया है या बहुत ढिलाई ले आए हैं। ये बिल्कुल ठीक नहीं है। अगर आप लापरवाही बरत रहे हैं, बिना मास्क के बाहर निकल रहे हैं, तो आप अपने आप को, अपने परिवार को, अपने परिवार के बच्चों को, बुजुर्गों को उतने ही बड़े संकट में डाल रहे हैं। रामचरितमानस में बहुत बड़ी बात कही गई है। आग, शत्रु, पाप यानी कि गलती और बीमारी, इन्हें कभी छोटा नहीं समझना चाहिए। जब तक इनका पूरा इलाज न हो जाए, इन्हें हल्के में नहीं लेना चाहिए। इसलिए याद रखिए, जब तक दवाई नहीं, तब तक ढिलाई नहीं।
A very, very important message from the Prime Minister at a time when people across the country have just, so many almost seem to have given up. COVID fatigue rampant. Well, let's take a look at what the overall situation presently is. Now, there are some good trends for India. India, the trends seem to suggest, is declining while the US and Europe surge. There is a second wave prevalent in some parts of Europe right now. The daily deaths trend also, India declining, the US and Europe surging. But the big concern is with the festive season upon us, will India somehow or the other manage to prevent a second wave? That can be devastating. Now, countries with the most active cases, the United States, followed by France, followed by Spain, and then India. So, India fourth on that list with 7,48,538 active cases of COVID at this stage. Well, we've got a fantastic panel today to look at what the Prime Minister had to say and the path ahead. Dr. V.K. Paul, member of the Niti Aayog and chairman of the Board of Governors of the Medical Council of India, with us. We're also joined by Dr. Hemant Deshmukh, Dean of the King Edward Memorial Hospital in Mumbai, and Dr. Rakesh Verma, Additional Director General of Health Services here in New Delhi. I'd like to thank you all very much for being with us. Dr. Paul, let me come to you first. You know, there's this new survey which has come out which says that by the end of February, things should be broadly under control. Do you believe that that is 110% dependent on what people do from here till then as far as wearing masks, maintaining social distance is concerned?
Well, yes, these projections made by a very eminent group of scientists does indicate that going by the known dynamics of pandemics like the present pandemic, yes, there could be tremendous slowing down and the disease could be at a very low level potentially. But this is, contingent upon unpredictable things not happening. In this pandemic, we must remember there are many unknown unknowns. And therefore, we could believe that the dynamics are such that such pandemics can subside. But it is more important for us to realize that all that is contingent upon how we carry our through in the next 90 days.
Yeah.
Because this is a period of three vulnerabilities. One, it is a period when winter is setting in. We don't know how this virus behaves in terms of temperature changes, humidity, and so on. But then look at Europe. With the onset of winter season, there is a catastrophe there. In 1918 epidemic, also the same thing happened. And these peaks are higher than the previous peaks of spring at that time and even now. The second is rising pollution, which predisposes the respiratory tract to be particularly vulnerable. But then the most important variable that we have in front of us, that we have a festival season, which is, which is surely something that will lead to the pleasure of the virus, because we will meet, we will have large gatherings, we would be in closed spaces. Now, if all that happens, then it cannot be taken at all for sure that we will survive with this kind of a decline, which is now becoming a pattern, a consistent pattern, and therefore we must be very careful in these months to come.
Yeah.
And the Honorable Prime Minister has taken upon himself to explain this to the nation, how important it is for us not to lower our guard.
Yeah, absolutely. In fact, just one moment, I want to go across to Dr. Deshmukh. Is that also your concern, Dr. Deshmukh, as Dr. Paul was mentioning, that in these winter months, there are all sorts of factors which can contribute to people being more susceptible to the ailment, and that these numbers might just rise with or without social distancing being maintained, and therefore it's all the more important to ensure that the norms we are talking about are indeed maintained.
Yes, Vishnu, what we realized is in the northern part of the country or India, the temperatures dipped to sub-zero levels, but in the western side, the temperatures really are not so low. So the virulence of the virus is definitely not known to the Indian subcontinent, and hence the virus which spreads amongst the vulnerable age group, that is the older age group, people with comorbidities, and the children, we really have to be very particular about them, protecting them at all costs. Because one thing you have to understand, Vishnu, that this is an invisible enemy. We really have not seen this virus at all. What we have seen in the last month was just probably a ripple in the entire wave. The first wave is already over. There was a small wave which we normally call as a ripple, but we definitely have to be very, very careful, since there is no cure for this virus, since there is no cure for COVID. I think we should only wait for the vaccine to show its true colors.
Dr. Verma, is this your biggest concern now, that people are fatigued? It's not just India, it's around the world. But the fact that various state governments continue to fine people, and nothing seems to be happening. I was speaking to authorities in Pune. They say that a few months back, in a period of a month, they had collected several crores just in fines, and these are small fines still, and yet people don't listen. In that sort of scenario, what do you believe needs to be done?
See, trust me that maybe that some people have the impression that people of the country or citizens of the country have become fatigued. But I can reassure you through your channel that medical fraternity is not fatigued at all.
Right.
The governments are not fatigued at all. We are tightened our belts to fight this COVID till the end, and we are determined to fight this. I can assure you the whole coronavirus, the hospitals, the government hospitals, the private hospitals, the state governments, the central government, and at the highest level of the Honorable Prime Minister and the Health Minister are fully prepared to deal with any situation, what income may be. But at the same time, as I said earlier also, this is a fight not of any government, neither of central government or the state government. This is fight which I and you have to fight. The corona doesn't walk into our homes. It is transmitted only through oral mouth or through droplets. If I cough and don't use a handkerchief or a towel, if I go out and don't use the mask, this corona would never go away. If I don't keep my hands clean, if I touch an unknown surface or a new surface, the corona will come through this. We as Indians have got a bad habit of picking our nose, putting fingers in our nostrils or eyes or in the mouth, using a toothpick now and again. So these are the main entry points for this coronavirus. So as the social norm is, maintain a social medical distance of at least 2 meters. Do not meet strangers unless it's really required. Do not go out of the home unless it's really compulsory to go out. Work from home. And in case you are stepping out, please do not hesitate in using mask. If you see Honorable Prime Minister in any photograph today, he is always using a mask, and that fairly large mask.
Right.
Honorable Health Minister. So if everybody can use, why I and you cannot use?
So
we must remember this is part of our
no,
our
absolutely, and I
part
take
of
that
this.
message, and that's something we try and convey one way or the other every single day, several times, mask use. But Dr. Paul, the festival season is upon us, the election season is upon us. There is zero social distancing which is maintained in election rallies. There appear to be limits to fines. You know, I mean, either people need to be fined a lot more, which in a poor country like ours is unreasonable. What does one do to get people to listen? Is just the Prime Minister making a statement enough, or does there need to be stricter penal grounds?
Well, I think it is very disappointing that the gatherings happen for one reason or the other. And even when there are no elections and no festivities, the markets look crowded. People ignore these precautions. People don't maintain social distance. They're not wearing masks. And maybe this is very, very sad. And ultimately, what the Prime Minister is pleading is to invoke our own individual conscience for our own self, for our family member, for our community, and for the nation. And remember, these efforts are not only to make sure the second peak does not occur, but think about it. If we take all these measures, the decline that has now set in will succeed and will be more rapid in time to come.
Yeah.
It is in our interest. It's not just to say that, okay, there will be no second peak, so let's try to do that. But remember, we have just possibly passed the peak, and if it is true, we still have a halfway journey ahead of us. This virus is not going to go away for a very long period of time. And if we invoke universal usage of masks, maintaining social distance and hand hygiene, protecting our elderly, we will have that journey with the least impact on our lives and least impact on the welfare of our families and people. So it is never going to be irrelevant. Let's say if today the mask use is 35%. If we raise it to 80%, imagine the decline in the pandemic that would take
And the number
place.
of lives saved, that's the bottom line.
Absolutely, lives saved,
the bottom
misery
line.
saved, loved ones not lost. It is so important. So I plead with people that kindly listen to the advice of the Prime Minister, and particularly the young people, because we find that the young people are mixing more, are in larger groups. They are out there, and they should be out there, but please maintain social distancing, wear a mask. And also we must remember, Vishnu, that it is the young people who bring infection to the more vulnerable people, such as the old individuals and those with sickness who are at home. So particular appeal to you to please communicate this through the media, to reach out to the young youth of our country, to maintain these three principles of wearing a mask universally, 2 gaz ki duri, and hand hygiene.
Yeah.
That is so critical at this stage.
Well, I'd like to thank you all very much for joining us, and we'll continue to spread this message for as long as we need to. We do speak about COVID fatigue, but I think a lot of us need to also think about the fatigue of the medical community in India. They are tired trying to save the lives of people, and we owe it to them to make their lives easier if people follow the rules. Does anybody care? That's the big question.